Heart disease causes some 1.2 million heart attacks every year. There are several risk factors for heart disease. Some are controllable, others are not. Dr. Jeffrey Stein of Boca Raton Regional Hospital joins us to break them down for us. Thank you so much for joining us, Doctor.
Thank you.
First question here, 128 over 80 seems to be the magic number people associate with healthy blood pressure. Not necessarily true, though.
We do know that blood pressure is one of the leading causes of heart disease. And we do know that treating hypertension is essential.
Sure.
Lower is always better.
Okay. Lower is always better. We know that. Hypertension does not always present symptoms, though. It goes untreated in many people. What good advice can you give for hypertension here?
Hypertension has been the silent killer for years. It's an asymptomatic disease. Getting your blood pressure checked regularly is critical. Either through your doctor, stop at the fire stations, they're always willing to help,
Sure.
Go into the local pharmacies, but always get it checked regularly.
You always see that at emergency personnel giving out free, and like you said, Walgreens. People check their blood pressure almost every day sometimes. Is that something you'd recommend?
It is important to get it checked. Some people go a little bit overboard where they check it 4 and 5 times a day and they obsess over it. I think if you just have a good feel of your blood pressure being under control, once a day, once a week is obviously a good idea.
Let's talk about what leads to hypertension. Age, weight, kind of tell me what goes into hypertension and possibly what people can do to prevent it.
There are other risk factors for hypertension. Obviously, genetics do play a role. Diet with high salt content is one of the other leading causes. Alcohol consumption, obesity in this country is, as you know, a big problem. So maintaining a healthy diet, making sure that you live a healthy lifestyle.
Sure. Besides that, exercise and eating, is there something you can do once you know you have hypertension to treat it and get back on the right track?
I think if you go to your doctor regularly and he or she determines that you do have hypertension, sometimes lifestyle altering methods do help, and sometimes you do need medicines. I think listening to your physician is very important.
For those who might not know or experts in hypertension, like yourself, what's the worst case scenario here? Leading to a heart attack, kind of talk about what it can lead to and what you would feel in that circumstance and knowing to get to an emergency room.
Again, it's the silent killer. People don't always realize that hypertension is upon them. Only in severe cases when the blood pressure is severely elevated would you feel symptoms. At the first sign of having those symptoms, you should go to the emergency room if you're feeling headache, dizziness, chest pain. But for the most part, just consulting your physician on a regular basis is the best way to prevent it.
All right, Dr. Stein has that advice today. Thank you so much for joining us. And Boca Raton Regional Hospital sponsors our expert and underwrites our Ask the Doctor feature.